Hi, everybody. This is Ron Lewis with MedicAppShopper.com, and we are in the annual election period, which started on October 15th, 2024, and it goes through December 7th, 2024. And this is the time when you would be shopping around for a prescription drug plan or a Medicare Advantage plan for next year in 2025. A lot of my clients ask me for help on this, and I thought I'd put together a short video explaining how to shop for a prescription drug plan and how to sign up for a plan. So, anyways, I hope you find this helpful, and here we go. Okay, so here we are at the Medicare.gov website. This is where you're going to want to go to sign up for a prescription drug plan. And the first thing I would recommend doing, if you haven't already, is creating an account. So to do so, you click this login button up in the top right corner. And if you've already created an account, you would enter your username and password to log in. But if you haven't created an account, then just click this button down here that says create an account. And it's very simple. You'll just enter your Medicare number and some other pieces of information. And the nice thing about having an account is once you do that, when you enter your prescriptions, it will save them. So you won't have to re-enter them every time. So it's not a requirement to have an account to use the Medicare.gov website, but it just makes it easier, especially for those people that take quite a few prescriptions. So the first thing I'm going to do is click this little link that says Health and Drug Plans, and then click Find Health and Drug Plans. And then they have both the 2025 and 2024 right now. So we're looking at 2025 drug plans. So enter the zip code. And then we're looking for Medicare Part D prescription drug plans. So you can also shop for Medicare Advantage plans on here. And during this annual election period, which goes from October 15th through December 7th every year, this is the time when you would shop for a new prescription drug plan or a Medicare Advantage plan. If you have a Medicare supplement, the annual election period has nothing to do with those plans because you can change your Medicare supplement plan any time of year. And it's easier, at least in California and a couple other states, if you do it around your birthday, because California has a law called the California Birthday Rule, which goes 60 days after your birthday each year when you can switch your current Medicare supplement to any other Medicare supplement that has equal or fewer benefits. So again, the annual election period has nothing to do for people with Medicare supplements. It's only for those that have prescription drug plans or Medicare Advantage plans. So I selected Medicare Drug Plan Part D, and then I'm going to click Find Plans. And then most of the time, 99% of the time, you're going to click this bottom button here. I don't get help from any of these programs like Medicaid, which is welfare and things like that. So for the purposes of this demonstration, this is the one we're going to use. And then do you want to see the drug costs? Say yes. And then next. And then this is where you start entering your prescriptions. So I'm going to enter 3 prescriptions today. And the first one is levothyroxine. And you'll notice as you start typing, they'll bring up other prescriptions that are similar sounding. So you don't necessarily have to type the whole thing out if you don't know how to spell it. So it's levothyroxine sodium. I'm going to click Add Drug. By default, it comes on the 50 microgram tablets, 30 a month. But I'm going to change this one to 100 microgram tablets. So again, you can choose whatever dosage you need. And then I'm going to click Add to my drug list. And then we're going to add a second one. So I'm going to click Add another drug. This is called latanoprost, which are eye drops. And I started typing Latan, and here it is here. And I click Add Drug. And by default, it came up to the right one that I need or that I want. I'm going to click Add the Drug Plan. And then the third one is a nasal inhaler, fluticasone. So I'm going to type that here. And this is it here. Click Add Drug. And by default, it gave the right amount. So I'm going to click Add to my drug list. So there's the 3 prescriptions I just entered. So if you want to remove any of them, you just click the link, or if you want to edit it, like change the dosage, you would click that link. It's very easy. And then I'm going to click Done Adding Drugs. So the next page is selecting pharmacies. So I always select mail order as one of the options, and you'll see you can enter up to 5 different pharmacies. So even if you go to one particular pharmacy, I always enter all 5 of them, because you'll find that every drug plan has certain preferred pharmacies that are cheaper to get your prescriptions at. So some are preferred or in network or out of network. So I always want to enter all of them. And then Vaughn's is usually very reasonable in price. I'll enter CVS and Walgreens, and we could do one more. I'll do Walmart. So I have all 5 down here on the bottom, and then click Done. And here are the drug plans, and these are sorted from lowest drug and premium cost. So these are like cheapest to most expensive. So for those 3 prescriptions that I just entered, the Cigna Healthcare Assurance RX plan so far looks like it would be the best deal for 2025. The monthly premium is $1.80 a month, and there is a $590 deductible. And don't be concerned with these deductibles, because those are usually applied for people taking tier 3 and tier 4 on a prescriptions or name brands. If you're taking generics, you usually don't have to pay anything towards the deductible. So far, this is looking good. So you can dig a little deeper by clicking Plan Details here. And this gives you more information about the plan. Like, I always go to this section right here, estimated total drug and premium cost. So this tells you what your cost would be at those different pharmacies. So you can see here the mail order option is $111.08, and that's for all of 2025. So that includes the monthly premium, deductible, co-payments, everything. So if you signed up for mail order, this is your projected cost for the whole year. And you'll see the Vaughn's here is $132.72 for the whole year. CVS is $363 for the whole year. Walgreens is $166.68, and Walmart is $185.64. So this is what I was saying, that you should enter all 5 pharmacies, because you'll find that certain ones are cheaper than others. The other thing I wanted to mention too, when you first log onto this page, check right here. See, this says covers 3 of 3 drugs. Sometimes that might say covers 2 of 3 or 1 of 3. So ideally, you want them to be covering all 3 of those prescriptions that you entered. And one other thing I just wanted to show you is on the bottom section here where it says View More Drug Coverage. I clicked that, and this gives you a little more information about those 3 prescriptions. And you can see they're all tier 1 and tier 2. And there is a quantity limit on the fluticasone. So I'm going to click that, and that says there's 16 bottles of that every month. Well, I only needed 1. So this is a non-issue. So there's nothing to worry about there, but you should always check this section as well. And those are the main things to be looking for. And so I'm going to, one other thing on this page, you'll see, here's the phone number here for non-members. So there's 2 ways to sign up for a plan. Once you find a plan you like, you can either call them directly and sign up on the phone, which is a more difficult process. I would normally recommend signing up from this website. And like if you wanted this plan here, you would click the enroll button. So it's much easier and quicker. It takes about 10 minutes to sign up by clicking the enroll button. If you call, you could be on hold for a long time, and they're going to ask or read to you a lot of legal questions that you have to listen to and answer yes and so forth. So if you know which plan you want, it's definitely much quicker to just click the enroll button and sign up that way. However, if you're not sure and you want to call them before you sign up, you can call and just give them all your information and see if their numbers are the same as what you're seeing on the website. The last thing I just wanted to mention to you is don't get hung up on the monthly premium or the deductible here. The only thing, or the main thing I should say, that I look at are these two middle numbers in here. So you notice if you go to a retail pharmacy, the cheapest pharmacy for the whole year on the previous page we looked at is $132.72 a year. So basically, this plan, if you went to that pharmacy, is going to cost $132.72 for all of 2025. If you use their mail order, it's going to cost $111.08 for the whole year. So don't concern yourself with the premium and the deductible. These two middle numbers are really what you're really going to be paying, which factors in everything: the premium, deductibles, co-payments, everything. And so with this plan, if you go to a pharmacy, it's $132.72 for the whole year. I'm just going to scroll down here and show you the difference. The next plan, if you signed up for that with those three prescriptions, it'd be $208 for the whole year. And then with this ARP plan, if you signed up for that plan, it'd be $17.21 for the whole year and $124.80 a month for the premium, compared to $1.80 on the first one. And I'm just going to show you the last one on here. There's 2 pages here. So the last one on for this particular prescription or plan, if you signed up for this Blue Shield plan, the monthly premium was $183.50 a month, and your total projected costs for all of 2025 would be $2,394. So you can see it's very important to shop around every year, and because these are 1-year contracts and these plans can change from 1 year to the next. So what's good this year may not be so good next year, and so forth. So I'm going to go back to the first page. And again, if this plan, if you signed up for this, would be $132.72 for the whole year. And if I wanted to sign up, I would click the green enroll button and join the plan. And then they're going to ask for your Medicare number and read you some basic boilerplate. And it's very easy. It takes like 5 or 10 minutes to sign up for a plan. And again, the nice thing is it'll save all your prescriptions for next year or anytime you want to shop around, so you don't have to re-enter them. Some of my clients take like 19 or 20 prescriptions, and it's really difficult to enter every prescription every time you want to look. So this definitely makes it a lot easier. Anyways, that's pretty much it. So I hope this has helped clarify. And if you have any other questions, you're always welcome to call or shoot me an email, and I'm happy to answer your questions. And again, my main focus is with Medicare supplement insurance. I just wanted to provide this information for my clients since it's something a lot of people would like to know. And again, if you have any other questions, please let me know. Thanks again. Take care.